Welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss another topic, that is molar pregnancy. Molar pregnancy is also known as Hydatidiform mole. Hydatidiform mole or vesicular mole Now, we'll see the meaning. What is molar pregnancy? We'll see the definition. Molar pregnancy is a type of gestational trophoblastic disease. It's a gestational trophoblastic disease. And it is characterized by the abnormal trophoblastic proliferation. Abnormal trophoblastic proliferation and resulting in cystic mass and grape-like structure in the uterus. This is called molar pregnancy. Molar pregnancy is nothing but it's a type of gestational. It's a type of gestational trophoblastic disease. It's a trophoblastic disease. Trophoblastic tissue is to take growth and multiplication. That is only abnormal trophoblastic proliferation. Growth and multiplication of trophoblastic tissue takes place, that is inside the uterus. And it is found in a mass, and then it is to be present like grape-like structure we can see inside the uterus. Like that structure we can see inside the uterus. This is nothing but a molar pregnancy. Next we'll see the types of molar pregnancy. Here in types, first one is complete mole and partial mole. Complete mole and then partial mole. Complete mole in the sense no fetal tissue found, no fetal tissue present. Entirely it covered with the trophoblastic growth. And then here partial mole in the sense here little fetal tissue we can find with the abnormal growth. These are the types of molar pregnancy. Next we will see the etiology, cause. Here main etiology is abnormal fertilization. Abnormal fertilization takes place. That is first complete mole. We will see first complete mole. Here fertilization takes place by an empty ovum. Here empty ovum by a one sperm chromosome. Here an empty egg, empty ovum in the sense there is no chromosome. There is no single chromosome. It's an empty egg. And then it is get fertilized by one sperm chromosome. In sperm. And then here 23 chromosomes. And then it's going to get doubled. Doubled means again 23. Again 23 chromosomes is to get. And then here it is going to form double karyotype. That is double karyotype. what happens? For 23 plus 23, 46xx or 46xy takes place. It is in the case of complete mole. It is in the case of complete mole. Next we'll see in partial mole. Partial mole. Here fertilization takes place by the two sperm chromosomes, and then here normal egg will be present, normal ovum will be present, and then it gets fertilized by two sperm chromosomes. Here we have to understand that it's a normal egg means already present of 23 chromosomes. Number of chromosomes present because it's a normal ovum. Here 23 chromosomes, and then one sperm, here also 23 chromosomes, and then here also 23 chromosomes. Now here it is going to form triploid karyotype. That is in the sense here this one 23 and then 23 total. Here it is 69 xxx or 69 xxy or 69 xyy. Here it's a triploid karyotype. It is present in the case of partial mole. This is the main etiology, main cause for molar pregnancy. Abnormal fertilization takes place. Next we will see the risk factors. Here important thing is maternal age. Less than 20 years of age and then more than 35 years of age. This is also one of the risk factor for developing molar pregnancy. And then second one is history of previous molar pregnancy. And then third one is dietary deficiencies. And then fourth one is geographic variations. These are the risk factors for molar pregnancy. Next we will see the clinical features. Features of molar pregnancy. Here first and foremost vaginal bleeding. Is present. It is dark brown or bright red in color. Vaginal bleeding. And then uterus is larger than gestational age. Then gestation. And then hyperemesis gravidarum. That is severe nausea and vomiting is present. No fetal heart sound or movement. And then developed preeclampsia or eclampsia. In the first trimester. Starting 3 months. Preeclampsia, pregnancy induced hypertension. And then grape-like structures. Grape-like vesicles we can see. Passage of grape-like vesicles per vagina. You can see. These are the clinical features for molar pregnancy. Next we'll see the diagnostic evaluations. First and foremost, ultrasound findings. To know the structure, whether it is in a complete mole or the partial mole. Grape-like structures entirely it is present or little portion it is covered. To know that one, they are going to perform ultrasound, UV, and then serum beta HCG. They are going to perform this test, that is serum beta HCG, to know the elevated level, that is human chorionic gonadotrophin. They are going to perform this one for the molar pregnancy. Next, histopathology. Histopathology they are going to perform. Histopathology and then chest X-ray. Here histopathology they are going to perform to see the trophoblastic proliferation. To find out the trophoblastic proliferation, and then they are going to perform the chest X-ray to know the lung involvement. These are some of the diagnostic tests for the molar pregnancy we can say. Next, we'll see the management for molar pregnancy. Here first we'll see the medical management. Here initial management and the follow-up. Here there are two kinds. Initial management, evacuation of uterus, that is dilatation and curettage, and after that Rh immunoglobulin, that is administration of Rh negative women after evacuation of uterus, that is Rh immunoglobulin. Next comes to the follow-up. Here serial beta HCG monitoring. Here weekly until undetectable, then monthly for 6 to 12 months. Undetectable of this one, molar pregnancy. And then here during this period have to avoid pregnancy. This is the medical management. And next comes to the surgical management. Here hysterectomy for the women who do not desire for future fertility. Hysterectomy is the surgical management for molar pregnancy. Next we'll see the complication of molar pregnancy. Here complication is persistent gestational trophoblastic neoplasia. It is treated with the chemotherapy, that is can be given methotrexate and dactinomycin can be given, and then monitoring for the metastasis, monitoring for the signs of metastasis. This is the complication of molar pregnancy. I hope you all are clear with the topic. Please like, share and subscribe to my YouTube channel. Thank you for watching.